Okay, hello. This is Dr. Adam O'Brien, a PhD in addiction studies, and I am looking at how can I best help people understand what it is that we do. And we, as the Wounded Healers Institute, and we are training people in, um, people and professionals in how to discern any um, dissociation and or addiction in their lives, in themselves, but also in clientele or anybody like that. So the programming has a variety of different ways of getting involved, and some of it can be individual coaching and or training and consulting. And so I keep using the word education over training because there is going to be a difference, um, namely, sourcing and, utilizing my research to highlight how we can get lost in the minutia, in the weeds of intellectual offerings, solutions, um, therapies, approaches, and being more of helpful in getting people to the right places, particularly when it comes to the topics of trauma, dissociation, and addiction, because we have seen time and time again that people are unable to meet those needs because they don't have the definitions that we feel that they need. We provide the definitions that we feel that they need and filling in the gaps, and part of our job is to put it out there and take criticism, sure, but also to offer it to people so they can experience it and understand it in a way that is organic and authentic to the process. And so the path of the wounded healer was born out of my academic work, my doctoral dissertation, and my work with Dr. Jamie March. And we are happy to be offering this to the general public, and having an honest discourse and conversation with people. So I will also be, recording Q and A's, and being able to highlight with people, the mainstay of our work, and to engage with the public in a way that allows our work to be um, lamented and or like solidified, to be um, concrete in the minds of the people who are wanting to learn about this. Now, there's a lot of different facets to how we learn and how we understand each other, how we relate, how we communicate. So there's a lot of layers to what I'm, teaching and or offering. And so we are looking at how does this training differ from others. Well, we invite people to get relaxed, and whether or not that is taking medicine such as like cannabis, meaning like CBD, and or if you are in states that it is legal, you can engage with THC. Um, if And this is for like clinicians as well, to be able to start to practice navigating altered states of consciousness, not necessarily for themselves or by themselves, but basically giving people a clearer understanding of what it means to be in an altered state of consciousness, let alone to be able to help navigate other people through them. Because our observation is, as a person in long-term recovery, like, people who are prescribing drugs doesn't mean they know how to take them and let alone live in them and or deal with the states that come up in those situations. um, and or what do these things mean and what do these things represent? So the mental health field has long had to endure with people prescribing things that maybe we agree with, maybe we don't, but either which way, as clinicians, we have had to deal with since the 1950s, really. um, Definitely like the 20s and stuff like that, but like we'll just go with kind of modern neuro medications and psych meds, past the like sedative, or the sedative, wow, good word. Um, the sedation of the medications, the sedatives like Haldol and risperidol and stuff like that of like the 50s and the 60s. Very powerful drugs, and now we have different types of powerful drugs that do different things. And people we work with people's consciousness and their awareness in a format that is more of like a mental health gym than it is a treatment model. It is for people who need to help to learn how to regulate their psychological and their medical needs. Um, the training offers people the professional path to work with us longer term and to be able to bring this into your area. And we also act as a screening due to our research and our developed model around how to best assess and to screen for dissociation and addictions. So the training invites people to um, relax with cannabis and or to learn altered states of consciousness, and to have people guiding you, and having meditation, and other variety of things to be able to do to help really bring out the psychological material that is often dissociated and or like not being done because they're addicted to something else. So our work really highlights the importance of understanding a much broader spectrum of presentations, transdiagnostic diagnoses like trauma and dissociation and addiction. Our work highlight that addiction is a transdiagnostic, and it underlies a lot of the things that people are going through, but it's not categorically understood as an addiction because addiction is not really understood. So this channel is really meant to help people understand what addiction is, and ultimately my work, but also to promote right thinking, right assessment, right screening, right understanding of the things that people suffer from and with, and an accurate portrayal of that. So, is this training right for you to be able to start exploring altered states of consciousness with an experienced guide and, an expert in that, navigating those fields, and taking, the plunge into um, really the beginning of a psychedelic revolution, let alone an understanding of dissociation informed care, and we would even argue for healing focused care. And so at the Wounded Healers, what we're really doing is training people. And academically, I am enforcing that there is a separate profession here, one that it could be an independent profession to check some of the claims of the medical model and psychology and how this industry is really ruining a lot of our abilities to be effective clinicians, or providers or loved ones or neighbors or whatever. So I look forward to seeing if this is something that fits for you, and reach out to us when you see fit. Take care.